Hello, my dear. I'm Dr. Alaa, Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today we have an important topic in gynecology and in surgery in general, prevention of surgical site infection. How to reduce surgical site infection. Okay, what are the objectives? What is the definition of surgical site infection? Classification of surgical site infection. Risk factors. How to reduce surgical site infection using preoperative measures, intraoperative measures, and postoperative measures. Let us start with the definition of surgical site infection. Surgical site infection are infections of the incision or organ or space that occur after surgery. Simple like that. Okay? Postoperative courses complicated by an surgical site infection lead to longer hospital stay. Of course, patient complicated with infection will stay in hospital for longer time, lost time from work, and there may be need for reoperation, and also maybe another complications may happen. Okay, according to CDC, Center for Disease Control and Prevention, the mortality rate associated with surgical site infection is 3%. And this is very important to be known. Okay, what about classification of surgical site infection? CDC put three categories for surgical site infection that occur within 30 days after surgical procedure. Okay, superficial, deep, organ space. Superficial means what? Superficial surgical site infection is confined to the skin or subcutaneous tissue. While the deep surgical site infection involves deep soft tissue. While organ space surgical site infection involves a body part that below the fascia. Okay, a body part below the fascia. So including the viscera and so on. So peritoneal cavities, spaces. Okay, so according to CDC, there are three categories for surgical site infection: superficial and deep and organ space. What are risk factors for surgical site infection? Maybe patient risk factor or operative risk factors. Patient risk factors including smoking. We know that smoking decreases body immunity, also decrease associated with vasoconstriction, so decreased tissue perfusion, so increased possibility of infection. Obesity, also another risk factor. We know that relative increase in adipose tissue to the capillary blood flow, decrease blood flow to this side, make it liable more for infection. So obesity, another risk factor. Diabetes mellitus, of course, diabetes, especially if the patient is not controlled, increase the risk of infection. Malnutrition, use of anticoagulants, presence of infection, septic focus still already present is a risk factor. Age, advanced age, also associated with increased risk for infection with decreased tissue perfusion with blood, decreased immunity, and so on. So these are patient risk factors. What about Preoperative risk factors. Duration of surgery. The longer the duration of surgery, the more the risk for infection. Blood transfusion, intraoperative. Wound classification. Is it clean or clean contaminated or contaminated or dirty and infected? So the possibility of surgical site infection increase, of course, if it is contaminated wound or dirty or infected already, or clean contaminated then rather than it is clean. Okay, so wound classification divided into four category: clean, clean contaminated, contaminated or dirty and infected. By the way, as a gynecologist, hysterectomy is considered what? Which category? Clean contaminated. Clean contaminated. Okay? Let us go to the next. How to reduce surgical site infection. Best practices to reduce surgical site infections are divided into preoperative, intraoperative, and postoperative measures. So let us start with the preoperative measures. Patient showering. Patient should shower with soap or an antiseptic agent at least the night before surgery. So you should instruct the patient to take shower the night before surgery with antiseptic agent, with soap and so on, or soap and so on. Okay? Hair removal. What about hair removal? Should the patient do hair removal or not? Really, patients should be instructed to not remove hair at home prior to surgery. For surgical purposes, hair shouldn't be removed unless it will interfere with the procedure. If hair needs to be removed because it interferes with the site of operation or something, so clippers instead of razor should be used. Why? Why clipper is preferred than razor? Because razor can cause microtrauma to skin that can be a needle of infection. So please avoid, ask the patient, instruct her not to remove hair, but during surgery, if there is need to remove hair for certain purpose related to surgery, you should use clipper or ask nursing staff to do hair removal with clipper instead of razor. Why? To avoid microtrauma to skin, which can be a nidus for infection. Clear enough? Okay. Also, you should instruct the nursing staff not to keep the skin bald, but short hair maybe. Okay? So shortening of the hair, but not bald skin. Why? Because if shaving up to bald skin also may cause micro trauma and cause a needles for infection. Okay? This is very important to be known. Okay, still we are in preoperative measures. Glycemic control. It is important for all women who are going to be in surgery to do fasting blood sugar, even if she is not diabetic. So, all women should do fasting blood sugar. And CDC recommend preoperative glucose should be less than 200 milligram deciliter to reduce the risk of surgical site infection. Okay? Of course, if the patient already diabetic, before surgery should be well controlled. Blood glucose should be well controlled. Next, in preoperative measure is hand and forearm scrub. Scrubbing for 2 to 6 minutes is just as effective for reducing bacteria without skin damage that can result from the 10-minute scrub. In the past, they used to say for scrubbing of hand and forearm for surgeon and the assistant, you should use 10-minute scrub and also use a brush. Okay, there is no need to use brush, and the time is changed now. Scrubbing 2 to 6 minutes is quite enough to reduce bacteria without skin damage. Either an antimicrobial soap or an alcohol-based scrub should be used with or without sponge, but not with brush. Don't use brush. You may use sponge, but don't use brush. Okay? Alcohol-based scrubs with chlorhexidine provide the best immediate and persistent antimicrobial activity. Alcohol-based scrubs with chlorhexidine provide the best immediate and persistent antimicrobial activity for lasting for few hours. Okay, what about intraoperative measures? Let us start with the operating room environment. Please maintain perioperative normothermia. Normothermia is important because tissue perfusion with blood is better in normothermia. Increase immunity, decrease risk of occurrence of infection. So, please maintain perioperative normothermia. Also, hypothermia decrease antibiotic penetration into subcutaneous and the adipose tissue. So, hypothermia is not preferred because it decreases blood perfusion and decrease antibiotic penetration into subcutaneous tissue and the adipose tissue. Normothermia is defined as a core temperature of at least 36 degrees centigrade on arrival to post-anesthesia care unit. What else in intraoperative measures? Skin preparation in the operating room. Prior to making surgical incision, the skin is cleaned to remove microorganisms. A solution of alcohol with chlorhexidine gluconate is preferred. Although there are many other alternatives, but for example, a solution of alcohol chlorhexidine gluconate is a good example for cleaning the skin before surgery. What else in intraoperative measures? Antibiotic prophylaxis. Appropriate antibiotic should be administered prior to start of surgery. It's better within 30 minutes, no more than that, especially when you are using cefazolin, which is recommended as a first-line prophylactic antibiotic. What is the dose? The recommended dose for cefazolin is 2 grams for patient weighing less than 120 kilograms. Okay? As I said before, administered up to 30 minutes period to incision. Okay, within 30 minutes from the starting incision. Before starting incision, I mean. Okay, within 30 minutes. Okay, what if the patient has an allergy to cefazolin, you can give clindamycin plus aminoglycoside like gentamicin. Also, there are alternatives for antibiotics also used in prophylactic to decrease or reduce risk of surgical site infection. This is for examples. It's advised if there is excessive blood loss, redosing of antibiotic is recommended in these cases. Okay? What is the excessive blood loss? Equal to or more than 1,500 milli blood. Okay? So if there is loss of blood 1,500 milli or more, redosing of antibiotic is recommended. What about post-operative measures? Surgical site dressing. CDC recommends that dressing remain in place for 24 up to 48 hours after surgery. From 24 to 48 hours after surgery. Okay? The Cochrane Review 2016 demonstrated that no one dressing was superior for prevention of surgical site infection. Okay? Okay. What else in post-operative measure? Vacuum assisted wound closure. What about vacuum assisted wound closure? Prophylactic vacuum assisted wound closure has been shown to reduce the risk of surgical site infection in patients who undergo cesarean section. It was found in some studies that using vacuum assisted wound closure was associated with decreased risk of surgical site infection during cesarean section. What else in post-operative measures? Patient instructions. It is important to instruct the patient about wound care after surgery. This is also very important to reduce surgical site infection. So, to summarize, to reduce the surgical site infection, we have preoperative, operative, and post-operative measures. You are trying to reduce surgical site infection as much as you can. And as I said before, there are many risk factors related to the patient or the operation. If the patient is a smoker, diabetic, old age, and so on, or taking anticoagulants, or the operative procedure, there is blood transfusion or long duration of surgery, or the type of surgery, is it clean or clean contaminated or dirty, the risk is increasing according to the type of surgery, as I said. This is the end of my lecture. I hope it was helpful for all of you. This is my scientific sites, my site on Amazon here in red, where you can find my books, textbook of obstetrics, textbook gynecology, contraception handbook, multiple choice question book, medical disorder and pregnancy, and gynecologic oncology book. Also my site on YouTube channel in blue here. You can find more lecture in OB-GYN, case scenario discussion, guidelines, quizzes, and so on. You can find in playlist all these. The last one is my blog, where there is some picture of my operation and articles. Thank you, everybody. Wishing you all the best.